9.9 Bolinas and 92.3 the San Geronimo Valley. We're streaming to you live at www.kwmr.org. Coming right up is Epicenter with your host, Jim Fazakerley. Multiple public health organizations are closely monitoring an outbreak of respiratory illness caused by a novel that is new coronavirus named 2019 nCoV, and that was first detected in Wuhan City, Hubei Province, China, and which continues to expand. Chinese health officials have reported tens of thousands of infections in China, and the virus reportedly spreading from person to person. Infections with the 2019 novel coronavirus, most of them associated with travel from Wuhan, have been reported in a growing number of international locations, including the United States. Some person-to-person spread of this virus outside of China has been detected. The United States has reported the first confirmed instance of a person-to-person spread with this virus on January 30th of 2020. In a rapidly evolving public health emergency like this one, the availability of timely and accurate information is critical. To answer that need, we're delighted to have an expert guest in public health in the studio with us this afternoon. She is Dr. Lisa Santora. Dr. Santora is the Deputy Public Health Director for the County of Marin, and she is tasked with monitoring and communicating updates about the spread of the novel coronavirus that has become a major global health concern in the past month. Dr. Santora, welcome to KWMR.
Thank you for having me.
It's really good to have you here. When I emailed you a couple of weeks ago, it was apparent to me that you had a really busy week, and I just have to believe that a lot of that has to do with chasing the updates and the preparations around the coronavirus. Can you tell me some of the things that you've been caught up with in your office in the past few weeks?
Of course. We became aware of coronavirus in December, just like many other people, tracking what was coming out from news agencies around this emerging disease. By January 8th, we started sensing that this was going to be a much more significant disease for us as public health professionals. And by the time you contacted me in, I think, the week of January 20th, it became clear that we saw surging numbers of reported individuals infected in China and started seeing severe restrictions that the Chinese government was placing on movement.
Right. And so just to catch our listeners up, the kind of numbers that I've been tracking, and I use just probably some of the same sources that you do, which is the Centers for Disease Control and also the World Health Organization, it looks to me like the number of confirmed cases globally now is up around 40,000. And just reported this morning that included 910 deaths, which to date surpasses the mortality from the SARS epidemic of about 18 years ago. Within that number, I think it's also been pointed out, or it's emphasized, that there's a growing number of patients who have fully recovered from their infections, and that's up to about 3,500 now. Those numbers come out almost daily. The rise is alarming, but it's so important to have context for the rate of the rise and how big a number that is in some context. What can you tell us that might ease some of the anxiety that's out there about this?
Well, we definitely were concerned by the rate of the rise. It was more challenging for us, both locally, regionally, and nationally, to track this because we weren't assured that the numbers that we were receiving from China reflected the actual spread of disease or the fatalities related to this disease. We always assumed from the beginning that it was an underestimation of the number of people that were actually infected with coronavirus because they were only reporting tested numbers.
So what do you do to sort of tease out the numbers? What sort of adjustments do you make then? You look at do you make estimates about what you think the actual numbers might be given the inevitable underreporting?
Yes, we began estimating that the numbers were probably 10 times higher than what was being reported, and that is what increased our response activity locally, knowing that this was going to have an effect on the Bay Area, especially because of the business that happens between China and the Bay Area. We have major flights that are going out of SFO to China. So with disease transmission, we knew we would be significantly impacted just because of the relationship between the Bay Area and China.
Right. And so what has happened just since you touched upon the flights outbound, inbound from China? Where are we at with that? Have they been restricted further? I know about half the flights were being canceled, but where's that moving? So
there were internal restrictions by flight companies, Delta Airlines, United, which were reducing their travel in and out of China. We also saw restrictions from the U.S. government restricting reentry into the United States, limiting it only to U.S. citizens and Chinese residents who had relationships with U.S. residents in our community.
Okay, and for any of those passengers arriving, there is a screening process that takes place, yeah?
Yes.
So I see you nodding your head a little bit in a little troubled manner. Maybe you could explain that.
It takes time for the machine to be built to respond to any disease of concern. And that means there needs to be coordination between multiple agencies at all different levels of government. And I'm sure your listeners would not be surprised to hear that that's challenging to do. Even conceiving of how you yourself might have traveled back through immigration and what a complex process that is, add a screening process into that with limited understanding around why this is happening by different staff members, and it can make it very complicated. For this weekend was the first time we started receiving notice of local travelers returning into Marin County. And even in making contact with those individuals, not all were screened appropriately or should have been referred to the local health department.
Okay, so could we then safely conclude from that at some point, locally and certainly regionally, we'll start to see an uptick in the number of cases that become confirmed in this region?
I would expect to see disease confirmation increase in Marin County and in the Bay Area. I think it's to be seen whether this reaches pandemic levels. It reminds me significantly of Zika virus, where we had a big surge in the beginning and had to build our response engine to meet that disease. And then we've seen a significant reduction in testing positive for Zika in our community. And we haven't seen the surge yet in Marin County of individuals testing positive. We have seen coronavirus test positive. The differentiation you made earlier is important, that we are testing for a novel coronavirus. So this is a new genetic code of this virus. But most of us have been infected with regular old coronavirus many times because it's just a common cold.
I see. Okay. Well, if you're just joining us, this is Epicenter, and I'm your host today. I'm Jim Fazakerley. In the studio with us is Dr. Lisa Santora. She is the Deputy Public Health Director for the County of Marin. And we're talking about a really timely subject, which is the spread of the novel coronavirus from Wuhan, China area, and talking about some potential risks that are part of, being part of a global community here. You mentioned about the apparatus that has to be built up around responding to an outbreak, and I want to ask you some more about the nuts and bolts of what that looks like. But also, can you tell us what is your toolbox look like for surveillance locally on the coronavirus?
So we have a communicable disease and prevention control team out of the public health department, and we rely on a couple of things. One is right now receiving information from the California Department of Public Health regarding contacts. So, for example, there are individuals that may have had contacts with people known to have been infected with coronavirus, and we receive those reports. We also receive the reports of travelers, so we engage in something called Public Health Supervised Self-Monitoring. It's not.
I'm sure there's an acronym behind that.
I haven't found a good one for that one yet. It's not a quarantine. It is. It's advising people to understand that they need to engage in social distancing and not attend school or go to work for the 14 days from which they were last traveling in mainland China. And then our third vehicle is where it is a novel coronavirus, which means it is a mandatory reported disease. So by law, physicians need to report any individuals they may think be suspected of having an infection with this novel coronavirus.
And those cases are presumably going to be identified by a clinician who contacts a patient who has flu-like symptoms and then also fits the criteria of either knowing someone who recently returned from China or made the travel themselves. Does that seem accurate?
Correct.
Okay.
At this point, the travel to mainland China is the largest significant risk exposure most people in the Bay Area will have. Though we are still now seeing, we're beginning to see that person-to-person spread. We haven't seen that third-generation spread locally in the Bay Area where someone was infected by someone who was themselves infected by someone who had coronavirus. So that third generation down, we haven't seen that. But that's how diseases spread. It's not. We'll hit a point where there won't be significant people who had traveled to the Wuhan area returning to the Bay Area.
Okay. And what do you do in terms of planning around this kind of event? Do you have either provided to you or things that you sort of work up on your own here in Marin County, models for how scenarios might play out here in Marin? Is there something off the shelf you can pull from the CDC and run a simulation in the conference room?
We were talking earlier, because of the speed of communication these days, the CDC and the World Health Organization doesn't have the time it used to package up the tools and resources that local health departments needed to provide. Needed to respond to emerging diseases like this. So a lot of our time right now is building the tools ourselves locally, but we're really fortunate we have a collaboration of Bay Area health officers. So we have regular calls with health officers across the Bay Area to really inform our policy decisions to make sure we're all following in line with what is currently being recommended by the Center for Disease Control, and then having an alignment of our own response activities across the Bay Area. Okay.
And what are some of those response activities, if we can dive in a little to the specifics?
So our activities today were contacting returned travelers. It was surprising that many of the travelers who we contacted did not have the exposure that was recognized as a medium risk exposure. They may have just had a layover in Shanghai and traveling in another country. So that's our first step, is interviewing all of the returned travelers who were notified of and then confirming their risk level prior to the next step. The next step, if we do identify someone that is medium risk, then we provide them with education and advise them that they have to contact the health department immediately if they develop any symptoms. And then our role would be coordinating their care, coordinating that medical evaluation, making sure the healthcare facility is ready to receive them. So healthcare workers in our community will be protected from any risk of disease transmission, and then to follow that testing to make sure that's determine whether they test positive or negative.
Right. One of the articles that I was poring over today, because this is such an interesting topic to me, that I've been doing this deep dive on things like JAMA articles, and one of these noted really glaringly that a good proportion of new cases in at least one hospital in China were the healthcare workers in the hospital.
Right.
And so how much of a concern is that for you that could play itself out in our medical centers here?
I'm not as concerned as some might think. We really learned a lot from Ebola. Our healthcare system has been working tirelessly before this was ever announced to make sure that their healthcare personnel are protected and safe, and exercising that they're ready to receive emerging diseases just like this. So we have funding that comes from the federal government right into the county of Marin to support local hospitals and healthcare facilities, including skilled nursing facilities, surgical centers, to make sure that they're ready to respond to emergencies like this, as well as to make sure that they're ready to provide additional mutual aid and support if we have other events or disasters in our community.
And what does that look like for just a few more specifics, Lisa? Can you give us an idea of how could the local healthcare infrastructure surge, if you will, if there were a large number of cases in Marin?
So the first step would just be working through our medical health operational area coordination, where we're in close contact with our hospitals to see the volume of patients that they're receiving. We have had risk of surge in the past just because of the flu season, and that's something important to us. This is happening during the flu season, and flu is widespread. Fortunately, our systems between Sutter, Kaiser, and Marin Health, they're working hard to ensure the appropriate disposition of patients, that they're not staying in the hospitals, working with healthcare providers in the community clinics as well to try and reduce ER visits that are unnecessary and really saving our resources for those that might need more intensive or acute care. Our next step up is if additional resources are needed, then we can request beds and mutual aid. The hospital is requesting shifts of patients just within Marin County hospitals. And then if necessary, we can look regionally. We also have the capabilities to stand up a field hospital if necessary. Mm-hmm. It wouldn't be easy, but that's one of the capabilities that we are required to demonstrate as a recipient of this federal aid.
Does the military play a partnership role in that to bring in MASH-type units or large stand-up hospitals?
It could. At this point, California really has been developing its own resources. It has CalMAT, which is the California Medical Assistance Team.
Right. Okay.
And so California would try first to serve itself and meet the needs of its state, meet its state's needs, but it could, if necessary, it would request national support, and we have a system for doing that.
Right. And locally, we were just talking just before we went on air about how organizationally or from a leadership standpoint, if there was a need, you can actually stand up a separate command and control organization with its own facility locally to coordinate the healthcare response.
Right. We work closely with Marin Sheriff in the Office of Emergency Services. We have daily calls with them right now just to keep them up to date with what's happening, what's transpiring. We have the ability to activate either a departmental operations center or our emergency operations center at the Sheriff's Los Gamos facility if we need additional support and assistance. We fortunately don't need that yet, but we are exercising and making sure that we're making the decisions on a day-to-day basis if we need additional support.
Right. So now's the time for preparation, and I want to ask you some more detail about that in a second. This is KWMR, and the program is Epicenter. I'm Jim Fazakerley, your host today. And in the studio is Dr. Lisa Santora. She's the Deputy Public Health Director for the County of Marin. And we're talking about the global health concerns around the novel coronavirus of 2020 and what might be some of the implications for the County of Marin and how our health experts are getting ready for that potential. So you were talking about some of the things, some of the activities that you've been doing in preparation. What does that include in terms of training or additional equipping? Anything going on there?
So we have developed spreadsheets to begin tracking patients, trying to work it into our regular flow. That's what I'm anticipating. Just like Zika virus, we had to eventually integrate that into our daily operations. So trying to develop tools that are consistent with what we use every day. This morning we met with staff and just went through line by line the procedures and protocol for when we are notified, how to enter data so that our public health nurses are ready. We participate in a lot of phone calls now, both state-level calls with local health departments, Association of Bay Area Health Officer phone calls to coordinate, as well as CDC and also president-level phone calls, just so our team is ready to is up to date on the latest information to guide our decision-making around surveillance of patients and preparation of our healthcare system.
Okay. And just switching over for a moment just to talk about the virus itself, where do you put that virus in the pantheon of bad actors, from a public health point of view?
In the beginning, I put it between flu and SARS, and now I don't know. We were joking around today that we don't know the numerator or the denominator of fatalities. There was one report that had the fatality rate from 1% to 10%, and that's a big difference of a disease. So fortunately, we're the data that you reported earlier that we were seeing people recovering from the disease is reassuring. And so I think it's closer to SARS than I thought of originally in the bad actor realm, but I think it really is to be seen, and that's why we haven't rested on our laurels in our response. We've taken it very seriously to make sure we're ready to scale up to whatever it needs to be. At the worst the worst case, it's a good exercise for our team to be responsive to another pandemic threat.
Absolutely. Can you tell us a little bit about how that virus acts on the body? What is it about these coronaviruses that cause so much mayhem in the human body physiology?
Well, most of us have had coronavirus. Coronavirus is one of the most common causes of the common cold. But when there's something novel, that's when there's been a mutation, a genetic mutation. The virus has learned a new trick on how to live and replicate better. Mm-hmm. And so what we're seeing with this novel coronavirus is that it's no longer just those upper respiratory symptoms that are annoying, the sneezing, coughy, runny nose, so you can't sleep. It actually is developing into pneumonia-like patterns or respiratory distress patterns or severe inflammation of the lungs. And again, we don't have the clearest picture. It sounds like the people most severely affected are older adults with chronic conditions, which is to be expected, but we still don't have the best epidemiological description of this virus yet.
Right. So what's helping to clarify that picture? I know that one news report came out that they had completed basically a reconstruction of the genome or a profile of the genome, which is apparently going to help a lot. And also that a number of centers now have live virus in their labs where they can do some work in that vein. What other kind of questions need to be answered before you can get an effective treatment or vaccine on this?
I think the first step is it's really reassuring to see the World Health Organization going out to China and to engage in co-research with the Chinese teams. The Chinese medical researchers and scientists are doing a great job trying to produce information. But again, there's just been discrepancies in the research that has been published to date. So I think having these multinational teams will start informing and standardizing the reports that we're seeing. Secondly, the Centers for Disease Control has already initiated engaging in research where individuals who have arrived either because they were evacuated, sounds like a big word, but that's the word they use, evacuated from Wuhan City and have been under surveillance and getting nasopharyngeal swabs, just starting to get our own data of individuals who lived in Wuhan City. So I wouldn't be surprised soon to see research published on American citizens who lived in Wuhan and who were under surveillance to have disease information from those populations. Mm-hmm. And this is what we're seeing is this particular virus is mutating or changing more rapidly than expected. It's already changed as much as a typical flu virus will change in 3 years. So again, it found a trick. So it's going to be when a disease mutates quickly, it's harder to develop that vaccination.
Right. You're chasing that particular strain.
Exactly. So we are not optimistic that vaccination is what's going to be the solution. I think we're going to hopefully it'll look more like SARS and MERS, where it just decreases in prevalence and frequency. And our main focus, again, this is the flu season. So it's really our own behaviors that can protect us the most. Getting the flu shot and thinking about the flu, even when coronavirus is in the news the most. Hand washing, coughing appropriately, staying home when you're even starting to feel sick. We have people who are just think of themselves as troopers for going to work, but they're actually spreading disease because it's usually the day before when you're feeling cranky, when you're the most contagious, and then you get the runny nose. So really working with all of our local businesses and organizations to support them, supporting their employees, staying healthy.
So in putting out some of this public health information and getting people to buy in protection against the coronavirus, we might see this massive side benefit in decreasing mortality from our own influenza.
Yes, and that's our silver lining to this is really, I think, the flu becomes our seasonal campaign that many people don't listen to.
Right.
But it's the same behaviors, excluding the vaccine, that really will protect you from regular coronavirus, novel coronavirus, or the flu.
And so then moving from that, people who want to get the best recommendations, other than what you just repeated here, where would you send someone to say, go here, here's your one-stop shop for information on this virus and what to do about it?
I go myself to Centers for Disease Control. They have a great webpage. They've really done a tremendous job in the past decade of trying to make it user-friendly. So whether you're a healthcare professional or public health professional or a member of the general public, it's visually appealing and you'll find it easy to navigate. We also have created our own website. So there's some more local information, marinhhs.org/coronavirus. And so that is our way of communicating locally and just addressing some of the concerns that we're hearing from the public. We receive calls ourselves every day from the public concerned about coronavirus, and we try to tailor our frequently asked questions exactly to that, responding to the questions we're hearing from the community.
So how would you advise people who have these kind of questions just to start with the local website and take a look at the FAQs there and see if those are addressed? And then if not, who can they go to and have a person-to-person conversation about it?
They can call Marin Public Health, our Communicable Disease Prevention Control Unit, at 415-473-4163.
And like any good radio program, we always insist that you repeat that number.
415-473-4163.
Okay, great. So, and then just a couple more questions. So, at this point, what are your own personal gut instincts about where this health concern is going to go, where the coronavirus outbreak is going to move globally and then locally?
I believe we'll definitely see more confirmed positive novel coronavirus tests in the United States, specifically in the Bay Area. I don't know the rate of that transmission, and that's, I think, to be seen. And I think this last week was the first week we didn't see such a rapid increase of reported cases from the Chinese government. It was the lowest increase, and so that's reassuring that it might have hit its peak in Wuhan and certain provinces. But what I would expect is as the travel restrictions decrease in China, there was natural holidays with the lunar holidays where businesses were already closed for this time. As the Chinese national government begins to liberate their restrictions or liberalize their restrictions, then we'll see more movement. We are a global society. We are traveling in airplanes that are small compartments that make disease transmission easy. One of the first cases,
not unlike Petri dishes.
Not unlike Petri dishes or children.
Yeah, right.
And so I would expect to see more contacts reported to us, expect to hear more healthcare professionals having individuals who travel to China and are reporting that they develop symptoms, and expect to see an increase of testing in our community. Okay.
That sounds like a good way to wrap up this topic. So we've been talking today with Dr. Lisa Santora, who is the Deputy Public Health Director for the County of Marin, and also is becoming an expert on the novel coronavirus of 2020. And we've been talking about ways in which the county responds at their level and how information is being disseminated at the national and global level, and what we might expect in the coming months with the development of this outbreak. I want to thank our guest, Dr. Lisa Santora, for coming in today and helping share her wisdom about the coronavirus. I'm Jim Fazakerley, your host. This is Epicenter on KWMR.